Thanks for joining us today. We are talking about measles, the outbreak in West Texas, its effects across our state and across the country. And right now, Dr. Salim Surani, Coastal Bend pulmonologist, is joining us, a familiar face for viewers on First Edition for years and years. We appreciate your insight in this. Being a pulmonologist, I know you have a lot of thoughts on this, and also a group called CHEST. We can get into that and what y'all are about there. I would like to talk about a finding that just came out saying that we are at risk of losing our elimination status when it comes to measles. Your initial thoughts on this?
Good morning, John Thomas. Glad to be here. I think it's a very important thing. We have to understand the background. We used to have several million cases of measles a year, and we'll have 400 to 500 deaths a year before we start having vaccination. Vaccination came in the year when I was born in 1963, so I gave away my age right there. The other thing is that since then, we started implementing when the MMR came in, and the vaccine has an efficacy rate of 97%. So by 2000, we actually achieved an elimination status where the number of the cases has gone down so much that we felt that, okay, we don't have any cases. Every year we will have a little outbreak here and there, we'll have a few cases. But this year has been an exception. Just in the first quarter, we have more than 300 cases already, and the numbers are increasing, especially in Texas and now in the other part of the country too.
And
So
also
if the number
the
of
first
cases,
death as well, right? In a decade, in 10 years?
yes, it first death in 15 years, and we normally never thought that we'll be seeing the death in because of measles, but because of the lack of vaccination, the people are getting more sicker, they're getting hospitalized, they get pneumonia, and then they get into trouble.
It's my understanding that a majority of these cases that are popping positive for measles are in those that are unvaccinated or their status is unknown. How do we get across that this is whatever information out there is tricking them into thinking that, hey, this is the MMR is not the right way to go. Vitamin A is better. Let's dive into that a little bit and kind of explain what people should know about the MMR vaccine.
So one of the things is the vaccine has a proven efficacy. So it's not like something which has come in new. We have the vaccine since 1963, and just have to look back at the historical factor. I mean, we used to have 3 to 4 million cases a year in this country, and now with the vaccine and everyone was getting vaccination, we only had a handful of cases, and those cases also start happening mainly in unvaccinated patients. People will bring the infection from international travel, and when they come in, they end up in getting a measles, especially when you don't have a vaccination, you're at a risk for getting measles. If you're vaccinated, it has a 97% protection. Whereas on the other hand, the vitamin A has not proven to be role in kind of prevention. Sometimes when you're very sick, you can give 2 doses of vitamin A that can help, but there is no substitute of vaccination. A lot of folks have asked me, like, how this vaccine compares with, we see the flu vaccine where every time the flu viruses comes in, there is a different strain. Fortunately, measles and hepatitis B are one of these viruses which actually replicates year after year after year in the same manner. So the vaccine, once you get it, 2 doses of vaccine, your efficacy remains 97%. So that gives a good protection. Not only here, I mean, it helps in the worldwide protection of the measles.
That's the thing that I understand is getting back to the vitamin A. I know that was thrown out there and has been thrown out there recently as a solution. Instead of getting the vaccine, go to vitamin A. It's my understanding that vitamin A is sometimes used to treat after the fact or in more underdeveloped countries where vaccines aren't readily available. For those that are already in poor health, that vitamin A is necessary. Otherwise, it can lead to harmful effects.
That is very true. Means I think excess of vitamin A is also not good. But on the other hand, there is no comparison. There is no substitute for vaccination. So if you get a vaccination, 2 doses, that is going to be much more effective. And again, the side effects of vaccines are very, very minimal. And we rarely see those side effects. One of the key thing is that it's a live vaccine. So if you're pregnant or if you have a severe immunocompromised status, then again, you need to talk to your doctor, and maybe you need to avoid taking vaccine. But far and less, those are very, very, very small portion of people. So if you're pregnant, you can't take a live vaccine. But on the other hand, the risk of measles increases when you're pregnant. So if you're pregnant, you shouldn't be going near places where people are having measles or any outbreaks.
It's my understanding, about every year there's maybe 100 to 135 cases of measles at any given point across the United States?
And that is very true. It varies from year to year. We have a significant peak in 2019, and then it number dropped down again. Before that, the numbers were very small, and you'll have a clusters of outbreak where you have more than 3 cases here, 4 cases there, 6 cases there, but not like in what we are seeing in the West Texas, where we have just in 3 months we have a number exceeding 300.
I was going to say the latest numbers I'm looking at are 420, which far exceeds what we saw last year. As a pulmonologist, how concerning is that for you?
So the number has increased significantly. If you take a quarter, I think it's a 17-fold increase compared to the year previous. So it's very concerning. We know that if you get a measles, 1 in 5 patients will get hospitalized. 1 in 20 may develop pneumonia, and 1 in 1,000 may develop encephalitis, or even die. 1 to 3 people may die of complications, and we have seen that. So despite the advancements in the therapy, once you get it, there's no other uh, right away treatment. Means treatment is mainly supportive. So if you go on a life support, you just give a supportive care. Uh, in some cases, we have considered IV immunoglobulin, and in some cases, we have even used when they're having a severe measles, getting a vitamin A. 2 doses have been done, but again, the main thing is prevention is the key. In this case, we have a very effective prevention in the form of vaccine.
Well, a lot of families that choose not to get the vaccine that have children that go through this say, well, it's nothing worse than chicken pox. And they say that their kids are fine afterwards. Are there lingering effects? Are there things they should worry about? Or is it the kids that are really suffering through this?
So if you look at it, if you are not worrying about 1 in 5 kids who get the measles, they may end up in getting admitted in the hospital. Do you want your children to be admitted in the hospital? So you have to ask the question yourself. And then again, 1 in 20 kids who get that may end up in developing very sick pneumonia, and they may end up on a life support. So that is one of the things, is that the consequences are challenging. Once you get it, it becomes challenging. The second thing is the measles is a very, very contagious disease. So if you have somebody who has a measles, you need to take a good precaution. Otherwise, the people in your surroundings are going to start catching it very fast.
If you could explain the group that you're with, Chest, and y'all just released a flyer, if you will, or an infographic kind of explaining the breakdown of measles and what y'all recommend for treatment.
So, American College of Chest Physician is a group of pulmonary globally, and we have about 18,000 members. And anything related to chest or infection, we tend to educate not only ourselves as a pulmonary, we uh, also try to educate the community and the public. So the infographic is a short way to give the information, anything which is coming in significant. So it's a part of the education system.
And we'll have that information presented in this interview. You'll have a chance, if you're watching right now, you are seeing it on your screen. Very informative, a lot of information there. What do we do at the state level? What do you all recommend the group Chest when it comes to, can the state do more, or is the state doing enough?
I think the key factor is that I think we need to have a clear-cut messages, and I think whenever the messages are diluted, the public gets confused. So some says that vitamin A, you give it for prevention, and will send vitamin A. On the other hand, if you have a vaccine, there is no comparison. So I think if the message is clear, that will help the general public to understand that. I mean, as a clinician, I think when the patient comes in, they do trust us, and I think if we are totally confused and we cannot pass a message to the patient will walk out of the room more confused. So I think I understand that there has been some confusion somewhere, but again, I can tell you, if something has a 97% success rate, if you get 2 doses of vaccine, you get a good protection. That's excellent. But you got to realize that, not only for that, even for future, you need to get your kids vaccinated.
And
You
not
get
let
a first dose when you're 18 to 24 months, and then the second dose when you're 4 to 6 years of age. But if the measles outbreak is there, and if someone hasn't got it, at least get a first dose, because that's also going to give you a significant protection against it.
And right now, we're coming towards the end of school. A lot of kids will be out looking for summer break, maybe going somewhere. So, for parents that are planning trips, should there be a concern, or should there be even a concern of coming to Texas to visit relatives or to take in many of the beautiful sights we have here?
I think, I don't think so there should be any concern, especially when they're traveling, because I think it's clustered in a small portion. And I think if you look at the Gaines County, which is the area or a hot spot, but if you know of anyone having the infection, then you need to avoid it. But if you're vaccinated, I think you don't need to worry about it. You can be pretty good because the efficacy and protection rate is excellent.
And kind of wrapping this up, we did talk about on the verge of losing that elimination status. Are we staring down an epidemic right now?
I think there are multiple outbreaks. I don't think so. It is a spread like a wildfire, but I think we need to do more effort in containing those infection and risk, and we need to make sure that we promote vaccination for folks who have not received the vaccination. I think that provides a very good protection. So I think that's a key thing.
And as always, any other questions outside of hopefully people watching this getting some information that they didn't know, or just maybe a different reinforcer for them? Obviously, have that talk with your local primary care physician, right? Your pediatrician.
Yeah, that is absolutely true. And if you have signs and symptoms, you need to realize that if you get exposed to someone, the incubation period, time from the contact or to the time having a symptoms is about 7 to 14 days. On an average, it's 10 to 12 days. You start having fever, cough, running nose, conjunctivitis. You feel like you may be having some common viral infection, but then you start having some spots inside your cheek. And then you later on, after 3 to 5 days, you start developing some rash, which starts over the head, and then it goes down to your body, goes down to your chest, trunk, and arms and legs. So I think if you start seeing those things, any of those symptoms, make sure you cover your kid with a mask, and then see your doctor. Make sure that you're having those symptoms because it's very contagious. And if you have a small kids at home who are not vaccinated, make sure that you try to separate those kids out, because if they're not vaccinated, there is a very, very high chance of getting infection. And even if they're vaccinated, we need to make sure that we try to take the airborne precautions, because when the patient are going in the hospital, we always wear the N95 mask. We always try to have a gown and eye protection for those patients.
And Dr. Surani, as always, we do appreciate your insight, your thoughts on this, and helping us make sense of what we're currently seeing and where things stand and how we can do something about it. It's as easy as having that discussion with your doctor. We do appreciate you, as always, and your insight, sir. Thank you, and choose to make it a great day.